Hello everybody, how are you? I am Mohammed Ahmed and your teacher here, and I will be teaching you different questions and their answers. So I welcome you on classtheta.com where we will be discussing question. So let's get on the question. Our today's question is: the nurse is assessing a patient admitted to the hospital with rectal bleeding. The patient had a hip replacement 2 weeks ago. Which position should the nurse avoid when examining this patient's rectal area? Number 1, seams. Number 2, supine. Number 3, dorsal. Recumbent. Number 4, semi-fowls. The correct answer of the question: number 1, seems rational. Seems position is typically used to examine to rectal area. However, the position should be avoided if the patient has undergone hip replacement surgery. The patient with a hip replacement can assume the supine, dorsal, recumbent or semi-fowler position about with causing harm to the joint. Supine position is lying on the back facing upward. The patient in dorsal recumbent is on his back with knees fixed and soles of feet flat on the bed. In semi-forward position, the patient is supine with the head of the bed elevated and legs slightly elevated. So that's the correct answer of the question. If you have any question, just leave a comment. I will be answering you as soon as I can. Thank you very much for watching the video. Please don't forget to like, share and subscribe our channel. Until next question, bye bye.